Welcome, and thank you for joining our webinar, Optimize Your Surgical Scheduling Process. If you have questions regarding the content I'm showing, please feel free to submit your question use the chat feature. I'll start by introducing myself. My name is Allison Bieber. I'm with Ortho Northeast for 10 years. I've been with DataDrivers for 4 years. I work within all the revenue cycle departments, and I assist in workflow and product development. I also do a lot of analytic reports, and I'm a liaison between the revenue cycle departments and the IT department.
And I'm Tom Pollock. I'm the clinical informatics engineer at Orthopedics Northeast. I've been at Orthopedics Northeast for about a little over 12 years, with DataDrivers for 4 years. My primary responsibilities at Orthopedics Northeast is to be the ER liaison between the clinical department and the IT department, as well as project manager for many other things.
DataDrivers was founded in 2013, and we are a wholly owned subsidiary to Ortho Northeast, also known as O&E, here in Fort Wayne, Indiana. We're a 54-year-old company, and we've been on Centricity since 2002 and EMR since 2006. Like a lot of other practices at the launch of our EHR, we were struggling with it. Staff and providers were really unhappy, and we knew there's something we had to do. We're doing weekly meetings. So we went out and we visited other practices and heard from them. So we're hoping that you're able to learn something from us today. So as we progressed, we realized that we could use our data and also our IT department as a competitive weapon. So being able to use the Centricity products in a live environment has helped us develop many of the medical practice solutions so that you're going to see here today. This is the 5th webinar series that we're doing where we'll demonstrate the Centricity in the medical practice. Solutions you can see can be implemented in your practice with low or no cost, and then others can be purchased through DataDrivers, or may just give you some ideas maybe that you could take and use in your own practice. Please keep in mind we are an orthopedic practice, so the content is more focused on ortho, but concepts may be used for any specialty. We're founded in 1962. We do have 14 locations throughout. Satellite clinics. We do have some locations in Fort Wayne, Indiana. 85 providers, 38 of those being physicians, some surgeons, some non. We have podiatry, we have pain management, 32 advanced practitioners, which consist of both NPs and PAs. And we do have anesthesiology as well, included in the 38 physicians. And then we also have 15 CRNAs.
All right, today, just briefly going over there, and we hope that you are able to pick up some tips and tricks from us. But learn how we use these custom forms to create a successful workflow and organization into your surgery scheduling department. Also want to know how you can leverage the Centricity product in the post-op visit engagement to help you keep your patients engaged and your staff engaged, and then demonstrate the tools that can guide those staffs through that workflow. Our scheduling department consists of, again, we're talking about multiple offices. The 10 navigators, there's 3 sets of nurse educators, 9, 12 nurses, each of those. Different facilities that we do surgery at, regular, hospitals, some centers, and then 1 specialty orthopedic hospital. And not only we do surgical procedures, but also pain management procedures. We're going to end with the ordering process. So this is a form that we developed to aid our surgeons. There's also an equivalent form for our interventional procedures as well. But this is the surgery form where doctors would go ahead and it would identify what doctor it is based on the provider of the document, any diagnoses for the day. The things and tips and tricks hopefully you can pick up from some of these forms is typically in our forms we make red required, so our staff knows that they need to complete the things in red at a minimum to be able to proceed. Other things you may see, darker gray buttons like to add a new vendor, things like that, those are going to potentially show the staff protocol or information. Those are typically carried out throughout our different forms. We want to be able to have them see if there's any allergies that the patient has as they create their procedure or put the procedure in there, the time needed, any kind of special needs that the providers may need in surgery. That may be a special vendor, a piece of equipment, a position, whatever they want to put on their post-op or pre-orders so that the facility knows what's going on. The surgical clearances, if they want any kind of special physicians to follow, if they kind of post-op anti-coags or what the discharge plan, or any kind of spinal cord monitoring, that type of things like this. They summarize if they've discussed a risk and benefit statement, and the patient is going to go ahead and send them right to surgery scheduling, or it may call a date and once they have their calendar in front of them or something, and go ahead and schedule that. So this is for an example of what the surgeon would fill out to create the order. Diagnosing the patient to get the diagnosis on there. We created an ICD-10 form, which allows you to look at the body part, which is the knee, pick the condition. In this case, it's osteoarthritis. Then it triggers you to answer the right questions. What side is needed, what type of osteoarthritis you're looking at, and then add that diagnosis, adding in the ICD-10 code into the patient's chart and onto that surgical order. Planning procedure, this is a form that they use to go ahead and pick a body part. So if I'm going to do a knee surgery today, at the top we've organized some top 10, and as you can see, our top 10 has now become a top 12. Our physicians could not decide which two to drop off, so we decided to leave them there for them. Pick your procedures. You can put multiple procedures. Sometimes our doctors will say, I possibly might do this, so there's add a possible button. And times they may go in and decide, okay, I'm going to do this procedure versus that procedure based on what it kind of looks like when I get inside there. So they use this form to create that procedure line. Taking us back to that order, so now you can see the procedure line is filled out. I put in my total knee. I've done my things that were required, picked out my risk and benefit statement, and I'm now ready to proceed by hitting the Create Order button. This is what it looks like in translation. So if you're looking at your orders module, you're looking at EMR 9.8 as an example. All these forms in the process works in CPS 12 or all the newest versions. So this is the order, and then there's an example at the bottom there of the translation that we've created by the simple click of a button that talks about what the doctor talked about in the office, including risks and complications, limited to certain things, and that the patient's ready to proceed. This surgery scheduling team, we had mentioned we have 10 navigators. There's 3 or 4 at each of our main offices. What they do, their primary responsibility is they review the patient's insurance and the provider's orders after the visit is over. They have, and then they determine the path of the patient. The path of the patient could be the next thing, which is going to schedule tests like an MRI or a CT or ultrasound. They're also our test schedulers, so those navigators are our test schedulers. Arrange any kind of referrals or consultations that the doctors would like to get set up. Those are set up before the patient leaves the office today. We just team up with the nurse educators and the clinical staff to make sure that the surgery scheduling process gets facilitated efficiently. I also call them our front lines of our surgery scheduling department. department, because the phone calls come into them and funneled to the appropriate nurses or whoever else may be needed at that time. So they have their own encounter. Here's an example of when that surgery order is by the physician or his team. There's an automatic flag that's sent to the navigators, so they know they have a heads up that says in the Clinton office at 9:32 there was an order written for conduction study. So that patient's on their way, so you can look patient's chart, review any kind of other orders that might need to be scheduled or taken care of today, but the patient will be there shortly, in hopes that when the patient is escorted to that department, we can bring them right back to the desk and they don't have to wait back in the lobby. This is the actual encounter form. As you can see from the top, they schedule imaging studies and diagnostic studies, interventional procedures, surgeries, and consultations, all in the same form. We also try to get the navigators involved in our portal push, so you can see the portal pin if the patient registered, if they have a pin, so we can encourage patients to get online and check out their history, ordering renewing meds and different things like that in the future. First is our consultation. So if they choose a consultation, so these forms just walk them through. So what is needed for the consultation? Scripting in green so they can talk to the patient and be very organized, and every navigator basically has the same message you stated. So if you've seen a specific doctor for this condition before, we'd like to know that, just because we try to get them to the same nurse that's familiar with this patient and they're comfortable with already. Also, if there's any kind of preferences of a doctor that we're referring to in practice or specialty, we would want to know, have you seen Dr. Smith with that specialty? Because we can get scheduled specifically at IU Center, as the example shows below that. So we're done. You can also see there's some pain management referral information on the right as well. We're done. They can go ahead and send those auto flags. It basically tells them that the auto flags are going to be sent, so they can follow up with those things later to make sure that they actually happen. And it requires them to make sure that they get all the proper paperwork to that referral provider that we're sending them to. The nipple for them is their test scheduling. If they select on the imaging diagnostic studies, again, some scripting there. They're asking the patient if they're on any kind of medication specifically for this problem. Are medications working? How long did they work? If there's any kind of allergies going on. And they would then proceed throughout the form to create more details. At the bottom, you can see there was an order created 1/20 of 2017, so we're going to use that order. We've selected the facility and exam date, and the time arrival is completed after we make that phone call and after we fill out the MRI screening form. The MRI screening form that we use, basically you would go through that 1 through 32. Actually, there's a couple more that we got off on our screenshot. But as they answer the questions, it gives them details in red of whether to inform the technologist of this condition, or MRI is not permissible, so we need to go back to our provider and ask them if they want to do a different kind of test. This information is collected, and we use a laminate to give to the patient so they can follow it along, so we're not asking every single question. We just go through, are there any of these conditions that apply to you? Because the facility will want to know. So we put stuff in ahead of time so that way our phone call to our facility can answer the appropriate questions very quickly and get them on their schedule and get the patient on their way as quickly as we can. Surgery navigation. With our surgery navigation, we have part of a surgery center and a specialty hospital. As I mentioned before, we have 8 to 9 other hospitals that we schedule. So there are, the navigators need to decide if they're going to go to our surgery center or a specialty hospital, information is given to them based on their insurance. So if insurance is well covered at our surgery center and the procedure can be done there, then they would potentially go there. So they also review that information from the surgery order. The height and weight has been updated. They actually do a pulse ox while they're sitting there interviewing the patient. So we have that kind of SpO2 information for the nurse. We also cleanse scrubs and Lovenox education materials if the patient is going to be using that as their post-anticoag for a potential surgery, total joint surgery or something like that. So after completing that form, it creates some comments in the admin comments in the lower right-hand corner. With information can then be copied and pasted and put into the order for the next person who's in our team that's going to take over from that point. This form and the translation that it creates has been very helpful for our doctors and our surgeons to be able to look at the translation and figure out, okay, why did the patient go to the our orthopedic hospital and surgery center? Well, it was because of health status that was reviewed and decided that they're not a good candidate for that facility, so we need them into the hospital. Or if it was not the hospital, we get them into a hospital that might have critical care if that's needed, something like that.
We're going to go over our surgery estimate and counter form. This form makes the estimate process quick and easy for staff. So theaters will start the process when an estimate for insurance or no insurance is needed. Our comp department also uses this form to communicate with coders. So the form will automatically bullet insurance surgery estimate or no insurance surgery estimate based on the patient's insurance. There are different rules built into the form depending on the type of insurance. And at the top, you will see all the patient's orders. When staff click on the appropriate order, they will autofill the physician name, diagnosis, the procedure, and any surgical notes indicated on the order. Click that Send Flag Decoder. The form auto-routes to a shared desktop in EMR that the coding department monitors. This coding staff can then add appropriate CPT codes, the modifiers, bill charge, and then the contracted allowed amounts if they're applicable. The form makes it easy to flag the physician to verify the codes as well. So by clicking on that Send Flag to Physician, a flag is sent to that physician indicated on the order. So the physicians then can verify, yes, these are the CPT codes I will be billing. And the form automatically calculates reductions when necessary based on the patient's insurance. For example, if the fee is a percentage of the bill charge. So it completes the surgeon fee field. The form, this surgeon fee field here, the form automatically calculates a 25% reduction in the surgeon true field here. Same for the assist, MD, or advanced practitioner field there. The form is also set up to alert the coders when to send the form to our reimbursement team for contracted allowed amounts, and it's based on the type of insurance that the patient has. All the needed information is completed. Then go ahead and click that Send Flag to Patient Billing or Send Flag to Work Comp, depending on which department needs the information. And the form is auto-routed to the appropriate EMR desktop. Our staff can go ahead and call the patient and inform them of the charges. There on the right is the final format of the surgery estimate, and it's housed in the patient's chart in EMR, so anybody then can have access to that information if they need it. Along with that surgery estimate form, with insurance carriers having higher deductibles and practices are collecting more and more up front, to aid in the surgery estimate process, we're having all of our payer allowed amounts in Contract Payment Manager, and then staff in our billing office can quickly access all the payer fee schedules using the code lookup feature in CPM, and then we can quickly complete that surgery estimate form accurately as well.
And this phase of the surgery scheduling team is the nurse educator. Call them facilitators or SCCs or surgical case coordinators, depending on the path that they take. As I mentioned, they could go to a surgery center or orthopedic hospital or one of the general hospitals for surgery. So they'll essentially do the same job. Their job is to review the patient's health history and coordinate with the surgery schedulers to get selected dates with the patients. And they have to obviously coordinate those dates based on clearances and other things that they have to organize and order, pre-admission testing that needs to be taken care of. So overall, they just get the patient prepared for surgery. They educate them. They talk about discharge planning a little bit on who's going to be there to take care of them when they get home, and different information, how to prep the home, and make them as comfortable as possible going into this surgery. Facilitator encounter form, also called our facilitator surgery form. As you notice on the top was similar as the last form that we just looked at. The surgery orders are listed at the top, so you can manage multiple different orders for different doctors. When you open this form, select your procedure order, select your procedure, and once you select your procedure, and then it brings in the information that the doctor put on there. So the surgeon's name, the diagnosis, the procedure, how he needed us to schedule it for. If he chose, if he had a preferred facility, a date, a time, remission status that comes from that order, it's all brought forward. Any kind of special equipment or costs that he could have put on the order also potentially come forward. So there's documentation and a communication tool that's used by this nurse to talk to or to note that they notified the surgery scheduler and they completed that section. If they add any other diagnoses or procedures based on maybe the doctor called them and say, hey, I forgot to add that one, do that to the right section over there. The sections at the bottom, those are the history screening form. So as I mentioned, their job is to view the patient's history and make sure it's safe for the patient to have surgery, so they'll do that. They'll complete that section. The height, weight, SpO2 value should already be in there because the navigator helped them out and got that value for them already. And then they could do some pre-admission testing, whether they have the patient just go to a certain facility. What we do is call and make an appointment for the patient. So then put down the location, the appointment time, the date. The patient has that information ready to go. As you can see, another example or tip and trick is there's a PAT guidelines in that same section. That section in the lower right-hand corner, basically that takes them to it's a hyperlink that takes them to a shared drive. So we update those PAT guidelines more frequently and not have to change the forms. We'll review the risks and complications that the doctor did, figure out if there's any kind of risks involved or what risk level that they are in. Any kind of post-op anticoagulation education that they give the patient, document there. In the lower right-hand corner is the ability to print out certain materials, talk about anticoagulation for the patient, so they have that material. Example of the patient history, they all go through this new stop bank scoring system, sleep apnea assessment. Go ahead, and a lot of this, or some of this information is already pulled forward. The BMI and the age have already calculated, the gender, you already know that. So they just have to add a couple more things once they interview the patient, realize to find the assessment score, which can then pass on to the facility. History screening form itself that they go over, it's going to go over their allergies, their medications, the patient's history, any kind of previous orthopedic surgeries or other general surgeries, family history, and social history. Doing this obviously to make sure the patient's going to be safe and there are any known family history of antibiotics or any kind of family history of anesthesia or anything like that. They're trying to find out, and so we can prepare the patient so it can get scheduled efficiently as possible and safe as possible, and ensure that they stay on that schedule. This is the allergy review. As you can see from the form, there's script in there that asks, but these forms are also the same exact forms that we use in our clinic. So I've already gone through this process with someone step by step. So there are a few questions that are not relevant until it's decided that the patient is going to go to surgery. So to put the facilitator's information in a different color, and you can see mostly it's the purple. Go through and they'll say, okay, I see that you are allergic to this or that. In this case, the patient doesn't have any known allergies. Just confirming information. General health questions. Have you been sick in the last week? Are any kind of antibiotics? Are you running a fever? Go through the dental and flu information. If the patient's wearing dentures or that kind of stuff that, again, is pertinent if they go to a surgical facility, but not pertinent prior to deciding if they're going to have surgery. So they'll review the allergy tab, the patient's medical history. Again, I see you have a history of diabetes type 2, or if there's prostate cancer or the hypertension that's in there. So they'll make sure that this list is accurate and up to date. And then to go over pre-admission lab testing. Example here, so they can pick lab sets or individual labs based on protocols. Diagnosis list is the doctor's already diagnosed them, so they can grab the diagnosis from there. If there's a pre-op exam, or if there's specific things like Coumadin therapy, that kind of thing, or long-term use of medications, they can those diagnoses as well. Patient to surgery also includes the possible chest rays or pulmonary function, so they can also order those tests from the same form. So you're ordering all your pre-admission lab thing and from this form, and you see from the bottom that the procedure is pulled forward, so it also goes on the order. So when they get to the lab, they know what's going on. You're getting pre-admission testing for this surgery, what date is, and those types of things like that, and they may be on the order. An example of protocols, so from the lab orders, if our nurses don't remember what the pulmonary function test instructions are, they go ahead and there's a few pop-ups on the lower left-hand corner that come up and just give them. So those are just ideas or little help features that we give the nurses to remind them once in a while if they need clarification on protocol. So the first tab, the order history summary. So now I've gone through this first tab. I've history. I've collected that information. I've ordered my pre-op testing. You can see the testing order in the lower right-hand corner. Those are tests that I want today. I've educated the patient, given them a kit for Lovenox, so we're ready to proceed to the next tab. Tab 2, this is where they organize their medications. As I mentioned, they went over their medications in the review. Now they're going to start giving instructions. I see what kind of medications that you're on. I need you to stop these medications on these certain dates, and other medications you can take up to the day of surgery. So they organize this information for the patient, because all this information is going to get printed to a patient instruction sheet that the patient will have when they walk out the door today after our interview. The interview is actually done via phone, then the patient instructions is actually mailed to the patient at that point. Excuse me. So they will review anesthesia if needed, or any kind of pre-op or post-op physical therapy based on protocols. Again, buttons and hyperlinks that are in there. If there's any DMEs that are needed, or braces if it happens to be a spine patient. They need to arrange an appointment for the patient to come back and get their brace fitted. Actually, we like to fit the brace in the office today, but they have to come back and get it prior to surgery. They'll have it the day after surgery or whenever they go home. Any kind of surgical classes in the lower hand corner there, you can organize those. Our hospitals have classes for total hips and total knees and spine, which the patient understand from the hospital perspective what's going to happen. So it helps another level of education to help the patient be prepared for hopefully an optimal and safe surgery. Implant cards or discharge plan. Discharge planning is discussed in the bottom right-hand corner as well and noted. The third tab is where we organize our clearances. So we have to have up to 4 clearances. We may send out medical clearances, pulmonary, cardiac, diabetes, or maybe there's a dental clearance for one of our total joint doctors, pain management if they're a pain management patient that's outside of our practice. Order those clearances, and as you can see those from the in the middle, that we're telling the doctor about surgery that's coming up, also telling them about the labs that were already ordered so they can go into that hospital system and pull up that information and look at those lab results at that clearance appointment. Fields for the nurse to record when this information was sent out or when it was received. If it was cleared, were they given a written clearance or method was, and the date they forwarded on to the facility so they have that record and documentation so they start preparing charts for when our doctors arrive. On 2 sections they may or may not use if the patient if it's decided they're going to do an auto donor, they have the ability to information of how many units, the location, the dates that they can set up for the patient to their own blood. The physicians to follow, this is where the documents, family doctors or hospitals or internists may follow the patient while in the surgical facility. Remember the 4th tab, our facilitator form organization is as far as the instructions and the pre-op orders. We can tell the patient when we're going to call in before the surgery. If it happens to be a holiday in there, we can alter those dates so they know you need to call because we're closed tomorrow. You need a day before. Have your surgery date and what time to arrive. You can also note that they check a box that they notified pre-cert, so pre-cert can start working on pre-certing this surgery as well. Any special instructions that may go on the patient's handouts based on if they're a diabetic or if it's a pediatric patient or if it's a local or if it's allergic to penicillin or a breastfeeding mother. Any things may have some special instructions if they're checked. And this patient is a diabetic, so it automatically saw that it was a diabetic and it auto-checks that. So the nurse is not reacting that information, they're just noting that actually is on there. Additional pre-op orders that need to go to the surgical facilities upon arrival, any kind of DVT or VTE prevention, TED hose, TT, SCD devices need to be ordered and arranged by the facility. Instructions that can go on the patient's instructions that they'll leave with today, including their follow-up appointment. Hopefully we have their date of surgery decided, and also now going to give them their first step appointment, where to be, who it's going to be with, and then some other information for the patient. They need to stop their solid foods for surgery, so we can add that as well. The buttons at the bottom, those are used by our nurses, depending on the facility that they use, whether they're printing off the instruction checklist for the patient, or if they're printing off information about senior care or extended care information, or actually going to a home or anything like that. There's information that we can give patients. Create pre-op orders to send to the facility. We do the consent in the office. Also looking at different special instructions for other procedures like interventional procedures, spinal cord stimulators, and then specialty documents for our surgery center. Used to be printed in trifold and color and expensive. So it's all in their folder. Now we can put these copies of this information in their folder so the patient, when the patient leaves today. Here's the checklist. So patient, or when the nurse is working with a patient, a kind of work that still needs to be done that they may not be able to do that day when they're interviewing the patient. They're organized the clearance, but they won't have the results back that day, as an example. So this checklist is a work in progress from day one until the surgery actually happens. So you can see there's some things that have already been checked off that are already been done. So if the patient or if the nurse calls in sick the next day, somebody can jump in and figure out what still needs to happen. Or some who they get behind, or they need to go out for a while, or whatever that might be, they can work off of that checklist to see what work needs to still be done. You can see it was incomplete, and then once they have filled in the boxes and checked all the boxes off that things have been completed or reviewed, the patient is ready for final teaching. What final teaching for us consists of typically for a total surgery, for an example, would be we call the patient 2 weeks out and remind them what day to call in to get their surgery, and the medications to remind them to stop. If they had any questions off their patient instructions, is their house ready for them when they're back, and just reviewing some things. So just a quick phone call to make sure that they're ready to go, got all the DMEs that they need, and things are good for when the moment they get back home after.
So for all of the ordering and scheduling of the surgery, if your department is not able to get an authorization for that surgery for some reason, whether it be conservative treatment or like covered benefits, you want to inform the appropriate staff as quickly as possible, because you leave a hole in the provider's schedule, you don't have to. So this is our pre-cert denial form. When our pre-cert department is not able to obtain that authorization for a procedure, they can easily communicate with the clinical staff using this form to get the additional documentation needed to obtain that authorization. The box on the top left is the name of the pre-cert staff member. Then we have what was denied, when it was denied, with the provider info, the bar, and then also the side. The pre-cert staff, they'll go ahead and complete this whole section here. They're going to let the clinical staff know what the insurance company is, reason for the denial, and then also the documentation required by the payer. So the pre-cert staff will then route this form to the provider's person of attachment, or what we call them a POA. The POA is going to open this form, and they are going to answer these questions based off the reason for the denial. On their answers, different instructions are going to appear, as you see over here. So clinical staff, they can quickly go order physical therapy or imaging study, medication, or whatever is necessary to get the authorization needed without leaving this form. So we can get that physical therapy ordered quickly if we need to. They are complete, then actually and communicate with other departments, the navigation, the scheduler, pre-cert, whoever needs to know. Say if the denial is upheld, we do need to cancel the surgery. Just to make sure the appropriate staff are informed of that cancellation, so we can do everything that we need to get done. Looks like that's it for today. Looks like we do have time for questions. We do have a question that did come through during the presentation. It says, can your forms be used for other specialties?
That question is yes. I mean, there is some tweaking that can be done. Forms that you may not need if it's not an orthopedic practice, and possibly things to add to that. But the overall concept is yes, they can be used for anything. It's just the communication and documentation tool that is or helps those nurses to go through a step-by-step process to make sure things are not missed during a scheduling process. Any questions that we may have today?
Okay. If you do end up having a question later, feel free to email us. If you'd like to visit our website, we have many solutions and videos there if you will see any of our forms. And thank you for attending today.
Have a great